Hey everyone, welcome back to Dank Data Memes Take 2. We're back to some of the good stuff. We ended here last time and I didn't have time to finish the whole deck that I had ready for you all. We're going to try and get through them all today. We'll see where we get to. Let's get started. I foreshadowed this tweet earlier, but this is a radio host slash vlogger slash online pundit named Bill Mitchell. His argument has unfortunately, I think, been used a lot by some people who are on his end of the spectrum. It is pretty amazing that we have a global pandemic and it's politicized. So in other words, either it's a global pandemic or it's a nothing burger, depending on who you voted for in the last election. That is crazy. That is amazing to me. But that's where we are. Back to this idea of data and discourse, though. Now, by the way, partisans on either side of a political spectrum do this, but in this case, the partisanship is in support of the present administration, the Trump administration in particular, and arguing that we shouldn't do anything about coronavirus. We're making a big deal about nothing, and the left is responsible for being a chicken little about it. So here the argument is it's only 17 people who have died, and most of them are sick and elderly. This is on March 7th. So no big deal. And yet that evil left, he's saying here, right? I'm not making this up. He's saying their evil hearts are idiot brains, right? So the people on the left who are arguing that we should do a lot to try and prevent coronavirus from spreading are evil and idiotic because only 7 people have died and they were already old and sick. Let's see how Bill's doing in 2 weeks. 2 weeks later, 257 Americans have died. And now we are literally shutting down the whole country. I have lived a long time. This is the most insane shit I have ever seen. Okay, so again, it is insane to want to prevent the spread of a deadly disease because it's only 257 people. So here we're not talking about the potential. We're not talking about projections or models. It's just, hey, it was 17. Hey, it's 257, right? And then along we come by March 30th. And suddenly we're like, hey, well, let's make a deal. If we don't have more than 200, if we have 999,000 Americans die, then we can agree that President Trump's the best president ever, right? Now, I don't know what logic that is exactly, right? But you notice how first it was, hey, it's only 17 Americans. We don't need to do anything. The left is idiotic / evil. Hey, it's only 257 Americans, and we don't need to do anything. This is idiotic, right? Now, all of a sudden, the goalposts have moved to where if we can manage to only have 199,999 people die, then President Trump is the greatest ever. Like, what happened, Bill? What happened? I suspect he might be taking it a little bit seriously. I don't know, though. I can't read his mind. It's very confusing to me, but I think there's a slight change in tone here. And then a week later, on April 5th, all of a sudden, it's not even like, well, if we get less than 200,000 deaths, then it's success. It's just like, hey, everybody, death is inevitable. Like, oh, good. I'm glad I bet you said that, Bill, when on September 11th, 2001. Is that what you said too? You said we shouldn't do anything about it and just death is inevitable? I don't think so, right? So this is a very interesting position to stake out in light of the fact that he has been saying it's no big deal and we shouldn't do anything. And then suddenly, by early April, we were in pretty much the mode of realizing that it was quite serious and that it was spreading rapidly and that not enough had been done and we didn't have the potential to do enough, right? And so suddenly it's like, oh, well, everybody, death happens. Nothing we can do about it. So suddenly it's fatalism instead of, I can't believe we're doing, we're trying to even stop this thing. It's like, let's just let it go. And then this on the same day, April 5th, back to the whole fatalism thing. And this is directly relevant to our discussion from our reading of Joel Best's Apples and Oranges, Inappropriate Comparisons. Now, first of all, it's pretty poor taste to compare anything to the Holocaust, but fine, Bill, you do you. But is this an appropriate comparison to say we lost 6 million people during the Holocaust? Did we shut down our economy then? Of course not. This is pure insanity. So this to me is really sort of unlocking the whole conundrum around the rhetoric here. There's this rhetorical position that a lot of people have been staking out, and this is relevant to our discussion in the apples and oranges chapter from Best, where we're talking about dollars versus lives, for example, right? And the argument that's being advanced is, well, these lives are less important than the dollars. We shouldn't be shutting down our economy just to save some lives, and it's old people, weak people, whatever argument, right? I don't have much patience for that argument, but here's the problem: is it's not even one or the other, because that argument that we shouldn't shut down the country, and this is what Bill Mitchell's arguing here, right? Which is like, well, maybe we're going to lose a few 100,000, but hey, we didn't shut down the economy for the Holocaust. And do I have to say it? Do I have to say that the Holocaust was not a easily communicated viral infection? Do I have to say that sitting at home and watching lots of Netflix and eating too many snacks, which is what I'm doing? I'm not watching a lot of Netflix, but I'm eating too many snacks. But a lot of people are just, sitting at home and watching a lot of shows. Did we think that could have solved the Holocaust, Bill? No, nobody thought it could for a second. Do we think, on the other hand, that staying home and limiting our social interaction will help prevent the spread of this virus and will help save lives? Yes, we do. It's just astonishing to me that these people have a. It's not just that people say things; it's that this thing gets retweets and likes, right? And by the way, I'm sure this is up to way more than 56 retweets and 191 likes by now. I'm going to check, actually. I'm going to just pause it. I'm going to check and find out what happened to that. Okay, I'm back, and I could not find it. But, boy, he tweets a lot, that guy. Anyway, a lot of his tweets are actually straight up denying the numbers, saying the numbers are real, or they're not real, they're faked. It's a liberal conspiracy. They're made up. A lot of the criticisms you'll see in some of the early chapters of Best as well, from the Best's example about how advocacy groups argue about the numbers and argue about the size and scale of the problem. So anyway, here we go. So yeah, so hey, it's no Holocaust, so what are we worried about? We didn't shut the economy down for that. All right. This is a really clever use of a graph. The graph is defensible insofar as it's not really lying, but it tricks most people. And so be careful when you see a graph like this. In this case, it's being used by the White House. I think that the people making graphs at the White House are probably smart enough to know what they're doing. And so, yes, I am accusing them of intent to misinform with this graph. This graph is a good way to make it look like you're doing more than you are. First of all, the dishonest thing about this graphic right away is that it is a bar chart, and the bar chart implies that each day has that value. It should not be a bar chart. It should be a line chart. Would be okay to do here, because what this is a graphic of the total number of tests. And the total number of tests was under 200,000 in the United States until around the 21st of March. It was under 500,000 in the United States until around the 24th of March. It was under 1 million until around the 28th of March, right? But what it looks like is each bar is the number of tests done that day. It's not. The number of tests done this day on April 5th was that many more than the number of tests done on April 24th. So that's the number of tests done day on day. What you can tell from this graph, if you look at it carefully then, is that the increase in testing per day is actually almost none, which is why this is increasing in a straight line. We've been awful about this. There have been a lot of things to point fingers around about the response to COVID-19 in the United States, but fundamentally there has been a failure at the federal level. And I'm not trying to be partisan about this. The federal government has failed us. The reason the epidemic is as bad as it is because our response was too slow. We weren't prepared. There were other problems like not enough masks. We were selling masks to China when we knew they had a problem, and we weren't preparing for our own supplies of personal protective equipment. Fine, all that stuff was going on. But if you look around the world at the countries that have been successful at tackling the infection and keeping their economies open, which has been a priority for everyone, except for you'd think it wasn't, the countries that have been successful at combating the spread of the disease and then therefore keeping their economies more functioning have been places like South Korea, Singapore, Taiwan, Hong Kong. We could list China, but I don't trust China's data, so I don't want to cite it as a great example. But those four I just named have been very successful about limiting the spread of COVID-19, virtually eliminating it in some cases. And the way they did that was by scaling up their testing dramatically. They invested national scale resources into developing or duplicating the tests provided by the WHO, depends on the context, and bringing production of those tests to scale, increasing testing capacity so they could test a ton of people, because the key to limiting the spread is identifying people who have it and isolating them. That way you don't have to isolate everybody. And then contact tracing is the second step of this, which is if you don't have testing, you can't do contact tracing. So getting everybody tested that you can possibly that might have come into contact, and then contact tracing and isolating those people as well that have come into contact with someone who tests positive, so you can slow down the spread without shutting everything down. Now this looks really impressive. Oh wow, look, 1.7 million, 1.8 million almost tests done through April 5th, right? But it's not increasing. It's just chugging along, and the testing capacity was growing slower than the disease was, slower than the infection rate was. And we know now, looking back in time, that there were large areas that were actively spreading the coronavirus, and we didn't have testing capacity to even measure that. All right. Another example, this is not just a key trick of the Trump White House. Here it is, done by Apple's Tim Cook. Cumulative iPhone sales. And now it looks like a mountain. Now it's not quite as dishonest as a bar graph, but still our eye tends to see this as a per year or per month or even per week sales figure, right? But it's not, it's cumulative. So in 2009, if this was 100,000, I don't know what the scale is. There's no scale, that's a problem, right? But this is 200,000, and then it quadrupled, and then it doubled again, right? And so, wow, look at all the iPhones they've sold. If you're an investor, if you're somebody that wants to know whether to purchase Apple stock or not because their sales are increasing or not, what you need to pay attention to, and you might be fooled, is this part right up here at the very top. And if you look closely, that rapid growth that Apple saw is slowing. And Tim Cook didn't want to tell people we're not selling as many iPhones this year or this quarter as we were a quarter a year ago, right? And what you can notice is inflection points here, right? So this is a release of a new model of iPhone, and then it slows, and then this is a release of a new model, and then it slows, but then it slowed again. And that was bad news for Apple. There were competitors entering the market, Samsung in particular, that were eating into their market share, but they just showed this really big, impressive mountain of iPhones, right? So to speak, that has that little squiggle in there that's lying a little bit, misleading people a little bit about what's actually happening. All right, some more of this inappropriate comparison. So Best brings up the challenge of inappropriate comparisons between places, between groups, across time. The last thing he brings up is inappropriate comparisons between other social problems, and we see this a lot with respect to comparing coronavirus inappropriately to non-infectious diseases. Here's Tucker Carlson. This is when the IHME revised their estimate of coronavirus deaths downward based on the fact that a lot of jurisdictions were doing a good job of limiting social interaction, doing social distancing measures. And based on that results, the IHME, this is a UW institute that has been at the forefront of modeling the infection and its spread, their institute said, look, we think maybe 60,000 deaths, which is not as bad as it could be. It could be 200,000, or it could be, the estimate for doing nothing, just keeping everything open, not stopping anything, not business as usual, was in excess of 2 million deaths was the high estimate. So So 60,000 is good news, but here's Tucker Carlson saying, well, 88,000 people die from alcohol abuse every year, and we don't shut the country down for that. 600,000 people, and I'm sorry for the mocking tone, but seriously, how can you say this with a straight face? We don't shut the country down for cancer because cancer is not a communicable disease. It doesn't. You can't catch cancer from somebody who's serving you a drink at the coffee stand, and you can't catch coronavirus. Like, why do I have to explain that? Okay, rant finished. I did a little bit of this signal versus the noise discussion on my last Dank data memes talk. This is a great example of this. The New York Times has been doing just phenomenal work on data viz and actually like data sourcing in this area. It's been really amazing journalism. I like to harsh on the New York Times sometimes, but I think they really deserve credit where credit's due here. What I wanted to say about this is a great example of visualizing this problem in a way that people can easily understand. I'm going to wave my arms around in front of this a little bit here. So what we're looking at here is the noise, and we're seeing that this is the deaths in New York City that are above normal and deaths in New York City below normal month to month based on what we expect for that month. Some months are healthier than others. Flu season comes around every fall into winter, and we have more deaths due to flu, right? People die from complications of the flu every flu season. But when we look at these, there's some periodicity to it, right? So there's better months and worse months, and it comes and it goes. But this is what we would call the noise, right? And then there's this signal, something like this, like September 11th, 2001, where there were 2,700 more deaths than we would expect based on the average number of deaths in September, right? So there's an unusual death rate that month because there was a massive terrorist attack on New York City, right? Look over here. What we've got here is we've got the month ending April 4th. So March 4th to April 4th. This is, I think I took this screenshot on April 5th or 6th. What we've seen is we've got 3,350 coronavirus deaths documented. And now we're coming all the way back to Best's discussion of measurement and definitions, which is if someone dies, but we don't take a swab and identify that they died from coronavirus, did they die from coronavirus? And the answer for New York City prior to this was no, they didn't count it. They just counted a death, but they didn't say it was a coronavirus death because they didn't test. But guess what? Tests aren't available. If tests aren't available, can you test everybody? No. Are you going to use a valuable, scarce test on somebody who's already dead? No, right? So New York Times went back and got all the data. And by the way, the data is published yearly. And so there wasn't current data for 2020 for previous years, but they got the data for that month. And what they see is that there were 3,350 coronavirus deaths that were documented in New York City, right? But there were 5,300 deaths more than expected. So there's 2,000 extra deaths in New York City. The implication is that these deaths were due to coronavirus, maybe due to other causes because people couldn't get into the hospital because hospitals were too crowded, or because emergency services were slowed down because there's such a massive response to people getting sick from this virus, or maybe because people were afraid to go to the hospital and so they stayed at home longer than they should have and they died. We don't know exactly what caused it all, but presumably this is directly affected by the coronavirus crisis. And so now New York is counting these as coronavirus deaths, even though they didn't have enough testing capacity to evaluate what the cause of death was. That's really interesting. And again, this kind of noise, if we saw 30 or 40 or 50 excess deaths, we could just say, well, that's just, there's some months that are worse than others, right? But this is 5,300 more deaths than usual in 1 month. So this is not a noise, a random variation. This is a signal. All right, here's another way of looking at this. This is Fire Department of New York data. By the way, I try and put, if the source isn't obvious, I try and put citations over here. And so there's a news report that has this about it in it, and then it's from Fire Department of New York data. When the fire department does a call, including ambulance calls, when the first responders show up and they find somebody that doesn't have a pulse, They don't always determine a cause of death. That's up to the coroner. The coroner right now is really busy because there's so much death going on. There's 5,000 extra deaths in a month, and coroners don't have that kind of capacity, right? The way a death is categorized, if the first responders arrive on scene and someone doesn't have a pulse, they categorize it as a cardiac death. Look at the noise here, which is that. So we've got 2019 is the gray line, and then 2020 is the orange line. We see some noise, we see some variation, but every day of every month from January through March is well below 50 deaths per day, right? And then notice what happens here around the middle of March. It climbs up to around 50, and then by the end of March, it's around 100, and then by the beginning of April, it's over 200, close to 250 deaths per day that are just classified as cardiac deaths. That's the way we can verify that this kind of thing is going on. It's not just some excess deaths, it's also, there's multiple data sources confirming that this is happening, right? Now, let's talk correlations. This is a great example of a correlation. I don't want to have this thing go on too long. We've gone 20 minutes already. I'm going to try and keep it short, but this is a fascinating correlation. And it's a good time to sort of put our correlation thinking caps on and do a little bit of careful thinking about cause versus effect here. The bottom... why is that thing popping up there? Is that my note? Yeah, okay. There's a note that's popping up as a note. Okay. What we see is the x-axis along the bottom there is the percent remain vote for Great Britain. There's a referendum across Great Britain to remain in the European Union, or if you voted not to remain, you were voting to leave. So all the way on the left-hand side was the areas in Britain that voted mostly to leave, and on the right-hand side is the places that voted mostly to remain. And then this vertical axis is the extent to which people are reducing their time in the workplace. So places down here, the whole city, Edinburgh, for example, the whole city has seen an 80% reduction on average in time spent in the workplace. So almost everybody is staying home. People who are going to work for a very short time, or there's very few people actually going to work. That's 80% reduction. On the other hand, these places up here, we see maybe a 50% reduction in time at work. In other words, a lot of people are working a lot of hours still, right? Now, the clear correlation here is that places that voted to leave the European Union up here are still going to work, not staying at home, which is the recommendation, right? Places that voted to remain in the European Union are mostly complying with social distancing measures. If you are out to score political points and feeling ornery about it, you could look at this and say, well, those stupid leavers, they're endangering their health. But there's another compelling explanation. So be careful, because you could have a causal story, but also have competing causal stories. And they can be complementary too, right? But we do in fact see that social distancing has lower compliance with people who don't take the threat as seriously. So maybe that's what's going on, right? We see that in the United States, for example. But the other thing that might be happening here is there's probably a class difference. The people who voted to leave tend to be from poorer, more working class regions and tend to work in jobs that can't be done online. The people who voted disproportionately to stay tend to be from more affluent communities and tend to have the kinds of jobs that they can do remotely more easily, or that they have an economic buffer because they're wealthier, and so they can more easily afford to not go to work. So maybe what we're seeing here is not people being defiant about the stay-at-home orders or recommendations, whichever the case is, but maybe this is people who don't feel like they have a choice but to go to work. And those are the same people who felt like they did have a choice about saying bug off to the European Union. So it's an interesting dynamic there about that politics. All right, here's a quick diagram, and I think this is a good example of an overstatement of the severity of coronavirus. So a lot of the examples I've been doing are understatements or attempts to diminish the impact of coronavirus. This is a graphic, and it was an animated graphic. There's a link in the description, but I'm not going to do it for the sake of time. What we see here, though, is that on 7th of April 2020, we saw COVID-19 overtake heart disease as the leading cause of death in America. And this made a little bit of noise because people are like, wait a minute, COVID-19 is killing more people than heart disease, and you said it wasn't a big deal? It's a little bit of an unfair comparison, you guys, and it's quite unfair, honestly, right now, because here's why. Because heart disease kills 1,774 people per day on average in an entire year. So to find out how many people die on average from heart disease, we multiply 1774 times 365. To find out how many people die from cancer, we take 1641 times 365. That's the average per day across the entire year. Is that the average per day for COVID-19? No. This is the total for one day when the crisis was really peaking. Now, I hope when we finish this thing that we come out of 2020 with the total deaths per day of COVID-19 down here, low someplace, right? I don't want them to be up here. So this is really overstating the impact of COVID-19 by comparing one day's most extreme data to the daily average for other diseases for an entire year. It's really not a fair comparison. Here's another way of saying this stuff, and this is back to, we've talked about this a little bit, but this is the idea about absolute numbers versus percentages in a sort of a different way. First of all, I don't believe his math. It's not quite right. I think it's more like 1 out of 800, and even on April 14th, I don't know how he got to 1 out of 622. I don't think he did his math right. But let's suppose that we get a coronavirus death rate like last I calculated the death rate for New York City, and I've been wrong before on this, so you can correct me if you want. I'm okay being wrong. Last death rate I saw for coronavirus deaths in New York City proper, in the 5 boroughs, was around 0.00122. That number looks small. People who are trying to argue that this is not a big deal are using statistics like that, but even using it for the whole U.S., in which case it's like 0001, right? Or 00, 3 zeros and then a 1. So it's quite small if you use the whole U.S. as your unit of analysis, right? But this 0.00122 doesn't look very big, right? But the way we actually want to, if we want to put it into a different perspective, we just take 1 over that number. Sorry. 1 over 0.00122. And what we end up with is we say, oh, 1 out of 820 people in New York City have died from coronavirus. And that sounds different, doesn't it? Than 0.001. one person per 1,000 has died, right? Whereas that's, or the way it looks, right? It looks much smaller. So 0.001 is a tenth of a percent, right? It doesn't look very big. Whereas this 1 in 820 is like, oh, it sounds different. So again, Noah's goal here is to try and make it seem like a bigger problem. He's taking, like wants people to take it seriously, and here he says we need test and trace. I tend to agree, by the way, but it's a little misleading in terms of, I don't know where he got per 622, because that rate of death is higher than I know about. Anyway, I want to just take a minute to look at this tweet. This is not about data explicitly, but this is about the conspiratorial nature of these numbers. People who don't want the numbers to be right are sort of engaging in conspiracy level thinking, like Sean Davis is here. He's an editor for The Federalist, which is a conservative publication. But Bill Mitchell is on the same sort of wavelength on this too, which is, it's not just that this is bad and we need to worry about it. It's that it's a plot. It's a conspiracy, and we're the media, the scientists, the public health professionals, the college professors are all working concertedly to destroy the economy because they hate Trump so much. And I don't know what world you have to live in to think that somebody is rubbing their hands together gleefully about the idea, first of all, of a bunch of people dying, or Second of all, about a bunch of people being out of work. Like, that's a weird thing. I think there's some projection going on, is what I think is going on. But I just wanted to highlight this as like, this is beyond the whole like, well, data are good or data are bad or data is being skewed. This is what's driving some of the perception, some of the rationale behind presenting numbers selectively about how coronavirus isn't really a threat is motivated by this reasoning. We saw it from Bill Mitchell as well. So it's worth sort of acknowledging that. Back to Bill Mitchell. This is a funny XKCD cartoon. I'll let you check it out. I'm not going to read it to you. Back to Bill Mitchell again. Bill Mitchell is not good at math. Act Blue raised an average donation of $30.38. This would imply people are donating in uneven numbers, including pennies, which would be odd. Or it would indicate untraceable foreign donations and exchange rate translation, which would be illegal. Or you don't understand how averages work, my dude. Like, it's an average. It can be a non-round number. It's an average. Maybe he meant the median. No, he did not mean the median. All right, let's move on. This is another fascinating dimension on that political divide over things. I want to give, so I gave this example. I've looked at Bill Mitchell. I looked at this tweet about people who are sort of basically thinking conspiracy level theories about this. This is the Democrats doing this like hatchet job on Trump, and they're willing to sink the entire ship of US of A just to get revenge, which is nuts to even think that. But this is an interesting perspective because what we know is there are varying risk perceptions. There's a group of people who think that coronavirus is kind of a big deal, and some people who think that it's not such a big deal. And that's a really partisan divide, by the way. So people who tended to vote for Trump tend not to think it's a big deal. People who tended to vote for Hillary Clinton in the last election tend to think it is a big deal. And that's weird, first of all. But part of what might be explaining that, so obviously there's different media influences. So if you look at Fox News's coverage, for example, for all of March, basically, it was just diminishing the threat. Whereas most other news sources were pretty serious about it being a threat, right? Here's an interesting divide. What we've got here is the level of urbanicity and the number of COVID fatalities per 100,000 population. What we're seeing here is that in the Mid-Atlantic New England, the death rate is much higher in large urban areas and much lower in rural areas. That's true for the rest of the U.S., not as much of a difference, but still true in the rest of the U.S., where the places that are most affected by coronavirus are the largest cities. Guess what other characteristic the largest cities in the U.S. have? They're overwhelmingly blue, right? So we have this urban-rural divide where the smaller the town you get or the more rural you get, in general, the more conservative the voters become. Whereas the larger the town you get, the more blue the voters become. Obviously, Dallas is different than San Francisco, but still, cities are bluer than the countryside around them. So this might help us explain why there's a partisan divide over this particular issue, is that the risk perceptions might be partly dependent on how close you feel to the threat versus how distant you feel from it, right? Whereas if you're in the countryside, it's not killing a lot of people, so it doesn't feel as real to you. All right. The New York Times again has done this this crackerjack job of data visualization around coronavirus. Again, we've got this great example of the signal versus the noise. This is a historical average deaths for different places around the world. Notice that there's a min in each place in the summer and a max in the winter. So the death rates are higher around wintertime because of flu in particular, but just also, I don't know, it's like every death happens more in the winter. And what we see is these massive spikes in these places that have been so badly affected by coronavirus. Another example of signal and noise. Here's the noise. This is the change on month by 1 year, or sorry, year on year monthly change. And so what we see is like January compared to a year ago January, there's ups and downs. They tend to get amplified because it's year on year change, not average, not change from average, right? All the way back to the 1950s. This is by somebody named Lyman Stone, who's a He's an economist, and I don't know if he has a PhD or not, but he works for, I believe, American Enterprise Institute, which is a conservative organization. And I ran into this via a blog post, and then got pointed to his Twitter where he put this up, and he had somebody, I guess, challenging him that the coronavirus deaths in New York City were no big deal, and they were like, well, what about the Asian flu of 1967, and what about the, and he's like, fine, and he went back and got all the data, and he said, look, this is nothing like we've seen before, and I went all the way back to 1957 for you, and now look, we've seen ups and downs in the death rate, fine, right? But there's nothing like this in terms of what we've seen in New York City in the modern era, right? We're almost done. Back to Charlie Kirk and fact. Hydroxychloroquine has been shown to have a 100% effective rate killing COVID-19. And then, boom, I'm going to use that to score a political hit point against Democrat Gretchen Whitmer. So if this is a fact, Charlie Kirk, are you willing to admit you were wrong about it? When, first of all, people like Charlie Kirk, people like President Trump, people like what's her name, Laura Ingraham on Fox News, were flogging the idea of hydroxychloroquine or chloroquine-related drugs as a massive potential cure. Some people got sick from taking non-prescription, non-human use versions of the drug. One person died, I believe, unfortunately. But what we see is that this is data from the New York Times, where they looked at prescription records from a pharmaceutical marketing database, right? And what they found was that as President Trump was like, well, there's no bad side effects, and what harm can it do? What harm can there be from taking this drug? So we saw prescriptions skyrocket for this drug, which does have legitimate uses, by the way, but just not for treating coronavirus, skyrocket and have continued to be big. Right now, you see little dips here because there's weekends prescriptions, right? Don't go down. And guess what? Not only is it not 100% effective, it kills people. The study that led to all the furor about this was what was called an in vitro study, where they actually applied the drug to the virus outside of the human body, and then they found that they needed a lot of it to kill the virus. It didn't take a low dose, right? Which is what you usually need for stuff like malaria, which is one of the things it's used to treat. So these scientists, and I just want to read this headline, citing a primary outcome of death, researchers cut chloroquine study short over safety concerns. The primary outcome was death. You can't make this up. It's not The Onion, right? So this is the results section summary of that study. They were giving a strong dose of chloroquine to people who had a severe case of coronavirus and were in hospital in the intensive care unit, with the idea that, hey, maybe this thing will work and we can try it. And this is what you do when you're trying to solve a drug you don't have a known cure to. You have to try some things out, right? Here's what happened. Lethality until day 13 was 39% in the high dosage group, 16 of 41, and 15% in the low dosage group, 6 out of 40. In other words, people who took this 100% effective Charlie Kirk drug were 3 times more likely to die. SMDH, just SMDH right now. All right, so I can't even deal. Back to disinformation, misinformation, bad actors. We have Rudy Giuliani here, back on Laura Ingraham, and I don't know what he's good at, honestly, because he was a mayor for a long time, and people thought he was okay at that, I guess. But here he's saying extensive tracing is ridiculous, and says we should do tracing for cancer, heart disease, and obesity because a lot of things kill more than coronavirus. Back to best apples and oranges. This is an inappropriate comparison. Do I need to say why? I feel like I do have to say why, even though I'm frustrated about it. it's an inappropriate comparison because we really need to contact trace people because it's been shown to be effective at limiting the spread of the virus. Testing and tracing works. We've seen it work in different countries around the world already. And arguing that it won't be effective because more people die from cancer, heart disease, and obesity, none of those are contagious. And so tracing won't do any good. We're talking about two different things. It's an apple and an orange. All right. That's the end of that. I went on a little longer than I wanted, maybe a little rantier than I wanted, but it is what it is. I hope you stayed with me till the end. If you didn't, then you didn't see this part. But if you did, thank you so much, and I'll talk to you all again soon. Bye.